So from the reflections, one of the things that has really come out clearly is the need to rework our funding models in terms of budgetary allocations, to rethink Kenya's health financing model to ensure sustainable and equitable funding for healthcare. And this will include addressing inefficiencies in revenue allocations to county and prioritizing preventive care and ensuring that health financing aligns with community needs. We all remember Prof mentioning that perhaps we need to think about earmarking some taxes to go to healthcare. Then the other issue is the need for us to hold Parliament accountable for its role in safeguarding the right to health. Legislative oversight should focus on budget approvals, policy formulation, and ensuring that public funds are directed towards strengthening healthcare infrastructure, workforce, and service delivery. The other thing that has come out strongly is in terms of leadership and governance in health. We also the demonstration by Prof and having noted that without proper leadership, which is the foundation of enjoying our rights, then we'll be in a vicious cycle and Kenyans will not benefit. So effective leadership is critical in ensuring health systems function optimally. Governance structures must be strengthened to promote transparency, efficiency, and responsiveness in the management of healthcare resources and service delivery. Then there are also issues of accountability, and we need stronger accountability frameworks, which should be implemented to track healthcare spending, service delivery, policy implementation, and this will include clear monitoring systems, independent audits, and public participation in health governance. For community, there is need to engage with the community effectively. Community involvement is vital in shaping healthcare policies and programs. Strengthening grassroots participation ensures that healthcare solutions are context-specific and responsive to the needs of diverse populations. And then there is also a greater need to amplify the voices of the community in both urban and rural areas to ensure that both urban and rural communities have a voice in healthcare governance, which is very essential. We also need a platform for civic engagement, public consultations, and community-driven advocacy that should be enhanced to influence policy decisions and demand better healthcare services. I know there are so many that we need to focus on, but I thought these were important, and because of the live streaming and these sessions being recorded, we'll be able to review the videos and get more, even as we do our final report, which we will share with all stakeholders. Now, to the Afya Bora platform. I think over time, all of you have attended meetings which have borne no fruits. In terms of, you've been called to a meeting, maybe it's a right to health platform, and then from there you do not know what happened to maybe the recommendations that were given in that meeting. There are no follow-up mechanisms. So it could be you as a paralegal being invited to such meeting, and then the next time maybe you'll hear anything of this kind is in 1 year's time, maybe invited by a different organization. So it is out of that we thought of creating a platform for continuous dialogue. Allow me to just share a bit of story, even as we end this. So I want to use an example, and I know we have so many stories of how people are not getting the right healthcare services that they need. So Mama Boga sat quietly outside a health facility in the rural area, clutching her referral papers. Her child had been diagnosed with a treatable condition, yet she faced an insurmountable challenge. Access to proper healthcare was either too costly, too far away, or simply unavailable. Like thousands of Kenya, she was caught in a system plagued by inefficiencies, inadequate resources, and policy gaps. It is such stories And even Grace is a living testimony that has inspired us to create what we call the Afya Bora Platform, which will be a collaborative initiative aimed at transforming the health rights landscape in Kenya. And so today we have had representation from civil society, academia, paralegals, medical profession, and the community at large coming together for this stakeholder forum. And to us, the Afya Bora platform will be a very good initiative designed to bridge the gap in health governance, facilitate informed advocacy, and push for systemic reforms. The platform will serve as a dynamic space where stakeholders can engage, collaborate, and respond swiftly to emerging health governance challenges. Kenya's healthcare system, we know, is persistent with hurdles, from weak policy implementations. Prof was mentioning that we have so many laws that are good and the intention is good, but now in terms of implementation, it's very lacking. So the Afya Bora platform will seek to address some of these challenges by creating a centralized space for knowledge sharing, policy discussions, and advocacy coordination. So one of the things that we will develop is a centralized online repository for health rights advocacy. And the key opponent for this, it will be an open access online repository, which will house research papers, reports, case studies on health governance and policy. We have litigation experts in the room, so the repository will also have ongoing litigation and legal resources, including some of the resource or knowledge products that have been published by ICJ. And because this will not just be an ICJ platform, we are also going to work with like-minded institutions to ensure that we carry this work together. The platform will also have best practices and advocacy tools to support evidence-based lobbying efforts. Another thing that the platform will offer, because we want this to be a continuous dialogue, a continuous conversation where we keep these engagements alive. To ensure continued engagement and action, the Afya Bora will host quarterly dialogue series, which with diverse stakeholders, including policymakers, legal experts, and frontline health workers, to convene to discuss pressing healthcare governance issues. So this is just first of that meeting, and we are committed to continuing to hosting such in the future. So our call to action, we invite civil society representatives, medical professionals, legal practitioners, community members to join our movement, contribute resources, and also participate in discussions that shape the future of healthcare in Kenya. Now, I know Hamisi asked where civil society is in terms of engaging with the community. So there is some work that ICJ is currently doing. So far, we have gone to Makueni. We have also been here in Nairobi, in Dagoretti, and also in Kariobangi. And I am glad that one of our facilitators is here, Mr. Bilasio, who has really been helping us to mobilize the community so that we can engage and also just create awareness around the transition. So the journey has not stopped. We will continue. From Nairobi, we intend to go to Narok, to Kwale, Isiolo, and also Kakamega. So this is just the pilot phase, and we are hoping that through the issues that are going to emanate from visiting those regions, we will be able to come up with a report capturing the issues, and which through the Afya Bora platform we can discuss with the different stakeholders that will be there, and then we can find practical solutions.